no fiscal on this.
Excellent. All right. It feels like it has
Thank
a very
you for
good
your time
chance
today.
Okay. I'm going to close the public hearing on House Bill 4150 and do our final hearing on House Bill, open a public hearing on House Bill 4070. Maybe Senator Sollman will breeze in as you get started.
Chair Nose, if I may. Thank you, Chair Nose, Vice Chairs Goodwin and Nelson, and members of the committee. I am Maxine Dexter, I represent House District 33. Really excited to be here, and honestly a little bit sad because this is the last time I'm going to bring a personal bill before the body. So anyway, I am grateful to share House Bill 4070 with you, which will expand and strengthen school-based health centers across Oregon. HB 4070 is my only personal bill this session. I'm grateful for the time to remind you of what this bill does. HB 4070 will allocate $7.85 million in mental health and substance use resources to Oregon schools, which are facing a health crisis, as we all very well know. It also allocates $10 million in construction grants so schools can more affordably and effectively and efficiently build high-quality school-based health centers. It will add 10 new school districts and allow them to begin planning for school-based health centers. And that will lead to thousands of additional students benefiting from healthcare support through school-based health centers and school nurses without drawing down from the state school fund. The committee previously received an informational hearing on this during legislative days on November 8th. And since that time, there have been a few minor adjustments to the policy.
Okay.
It had, in its original draft, it had a fiscal of $5.8 million. I've raised that to $7.85 million. This change was made to better address the mental health and substance use treatment needs facing Oregonians, our young Oregonians. I added language to specifically call out that these funds can be used for substance use prevention, screening, referral, and treatment services, as this is a growing need, unfortunately, throughout our schools in our state. I've also raised the amount of planning grants from $1.1 million to $1.4 million to adjust for inflation. Some of you may have heard me discuss Maslow's hierarchy of needs. It's a framework for understanding human behavior first described by Abraham Maslow in 1943, explaining how humans are motivated to fulfill basic needs before advancing to more intricate needs. This framework for understanding human behavior reinforces what we see in schools. Students who are houseless or hungry simply cannot learn. These students are also less able to pursue access to health care. Schools-based health centers facilitate a stronger sense of support and community in our schools, while also offering health care and public health education and interventions. With the utilization of existing school infrastructure, we can truly meet the needs of our youth where they already are, where they already have trusted relationships, and also which can be delivered in a culturally competent and usually language-informed manner. Additionally, by providing students and families with healthcare and social services in a trusted building, school-based health centers efficiently close many gaps in our social infrastructure. HB 4070 is a good investment. School-based health centers reduce barriers such as cost, accessibility, transportation, and language that keep students and families from seeking the health services that they need. They incentivize school districts, education service districts, health and community partners to collaborate to implement a trauma-informed, community-centered health model. And this is based on the needs of each community, which will drive the implementation of these services. This bill balances the need to provide an immediate response to Oregon's youth behavioral health crisis, while also developing infrastructure for future needs, which we have yet to meet. That is why we have been able to have a broad coalition of organizers who are supporting and was introduced with broad bipartisan support. Thank you to those of you already signed on. At this time, I am unaware of any opposition to the bill. I'm grateful for the work of Senator Sollman. I'm glad also to see you here, who brought the bill in the 2023 session as Senate Bill 549, and she has gotten us to this point today. I hope you will strongly support this getting across the finish line in 2024, as our students and families are in crisis and we need to offer meaningful relief. Thank you so much.
Go ahead, we'll hear your testimony, and then we'll see if the committee
Good
has any
afternoon,
questions.
Chair Nose, Vice Chairs Nelson and Goodwin, and members of the committee. And I want to also say welcome to Rep. Yunker. I haven't had the opportunity to meet you yet, so welcome. I am Janine Sollman. I am the state senator for Senate District 15, which includes areas of Forest Grove, Cornelius, Hillsborough, and the Rock Creek area of Washington County. So we have a crisis in our schools. Attendance is down, disciplinary action is up, anxiety and depression are off the charts, and teen girls are being hit especially hard, with 1 in 3 girls now expressing thoughts of despair, depression, or suicide. The School Health Resource Response Act addresses these problems head-on. It provides resources and planning grants for the creation of school-based health centers, or SBHCs. Provides millions of dollars for mental health care, which allows a much-needed inflation adjustment to preserve SBHC workforces, and delivers funding for modular SBHCs units that can be dropped onto school properties as soon as their planning process is complete. This act builds on years of bipartisan work. Since 2007, Oregon has nearly tripled its number of SBHCs. Since each health center leverages state funding 4-to-1, our districts bring in an additional $23 million each biennium from private insurance, Medicaid funding, and grants. That's an amazing return on investment. And the impact on our students has been enormous. Between 2013 and 2015, schools that have increased SBHC's mental health services saw a 15% point drop in suicide ideation and a 7% point drop in suicide attempts among students experiencing depression, even while these measurements increased in schools without a healthcare center. As a former school board member, this issue is close to my heart. I worked on this bill in 2023, as mentioned, and I'm excited to partner with Representative Dexter and others that are sponsors on this bill to get it across the finish line. We all want our kids to be healthy, and I ask you to join me in giving them the resources that they need and deserve. Thank you.
Okay. Any questions for either the senator or for the representative?
I do.
Right on. Go ahead, Vice Chair.
Thank you. Thank you, Rep. Dexter and Senator Sollman. So you say here that you will select 10 school districts for the funding. How will those, what's the criteria for determining those school districts that will receive funding?
I think, yeah, we'll defer to Doug Riggs because I think it's not being selected. I think it's offering the opportunity, so.
Okay, so will they
Opt in,
actually
yeah.
write grants for the funding? Okay.
Mr. Riggs.
And
will-
then, so once they receive to be a recipient of the grant, are you then obligated to have a certain scope of services that are provided, or they still have flexibility with their own school district? Like, will it be, will there be a greater priority on mental health, substance abuse?
Vice Chair Goodwin, I can attempt to answer this in a way that former school board member, when our process was going through to adopt our school-based health center in Hillsborough, it's a memorandum of understanding between the healthcare provider and our district in what's provided and what is offered. And that is, per district that they have that. And I think what's exciting about this is that I think things that we have learned in lessons that we have learned in the years that we have provided these school-based health centers is we might not need a brick and mortar facility. Like some of these districts, which are very rural, which some of you represent, may be better off served by having a mobile school-based health center, one that can move to where the students' need is. So I think this is an exciting opportunity to kind of modernize what that school-based health center can look like.
Thank you.
Representative Deal.
Thank you, Chair. So these are not school employees, right?
No.
Yeah, all right, thank you.
Okay, I'm not seeing other questions, and I feel like we've punted a smidge to Doug Riggs, so we'll let him get up here and give his testimony and maybe answer a few questions. And then we do have a few other witnesses, and I think we're gonna We may go over 5-ish minutes.
Mr. Chair, if I may, I just want to let the committee know that we did submit an amendment that is changing the language in the bill from the 1.1 to 1.4 million to adjust for inflation that I mentioned. And it also takes out the school mental health model. That's not a model that is necessarily what we want. We want it to be inclusive, but not limited to just mental health. We want it to be more expansive. So that was removed. And so that is an amendment that would be coming for the work session, which we hopefully will have. Thank you.
Right on. Mr. Riggs?
Great. Mr. Chairman, Madam Vice Chair, members of the committee, for the record, Doug Riggs, on behalf of the Oregon School-Based Health Alliance. There is lots of very good testimony in the record. We don't want to go over that in great detail, but I will hopefully answer some of the questions that the members had. I'd point you in particular not only to the community testimony that you'll see from lots of partners from around the state, but also to Maureen Hinman's testimony, and there are extensive slides about exactly how the process works, and I'm going to touch on that just briefly. As I said in the November hearing, I've been doing this issue or working in this issue for quite some time, since 2000. As I said in the November hearing, I've been doing this issue or working in this issue for quite some time, since 2006, and at the beginning of the process, it was a one-size-fits-all process for school-based health centers. And in the 2007, 9, and 11 session, beginning of the process, it was a one-size-fits-all process for school-based health centers. And in the 2007, 9, and 11 sessions, we directed OHA to rewrite. The procedure by which and the requirements that would be imposed upon districts that wanted to pursue school-based health. The procedure by which and the requirements that would be imposed upon districts that wanted to pursue school-based health centers. And so we really took the model into the 21st century. So if you look at this chart on the screen, 21st century. So if you look at this chart on the screen, you'll see the results of that change, and you'll see the results of that change, and you'll see two things. Number one, you'll see that the distribution of school-based health centers is rural and two things. Number one, you'll see that the distribution of school-based health centers is rural and urban, large and small, north and south, urban, large and small, north and south, east and west. This is the list from 2021. I don't yet have the map that is 2023, but since then, so the east and west. This is the list from 2021. I don't yet have the map that is 2023. But since then, several other districts have applied for that opportunity to put together a plan. And I really can't emphasize that enough, that we have turned this program into a community to put together a plan. And I really can't emphasize that enough, that we have turned this program into a community-based program. The OHA will put out a request for information, a request for participation, and a school district will make, OHA will put out a request for information, a request for participation, and a school district will make a decision whether or not to apply to go through a planning process. So number one, the district decides whether or not they want to pursue that process, and then they get a grant, and they sit down with their community partners and the school planning process. So number one, the district decides whether or not they want to do that process, and then they get a grant, and they sit down with their community partners, and the school board and the community has a great process. And Maureen had a story during the November hearing of her. The school board and the community has a great process. And Maureen had a story during the November hearing of her efforts with Prairie, Oregon. Very rural, very small, very conservative community in Eastern Oregon. Very rural, very small, very conservative community in Eastern Oregon. And at first they came in very skeptical, and by the end of the process, they were unanimous in support. And that leads me to the second element that we have built into this process, which is that a school-based health center really is a flexible model. Second element that we have built into this process, which is that A school-based health center really is a flexible model today. So you can start out with a full-blown school-based health center with, you can start out with a full-blown school-based health center with, physical, dental, and mental health at a school. You can start out with a school nurse model, which has become physical, dental, and mental health at a school. You can start out with a school nurse model, which is becoming very popular at all. And then as far as scope of services, there's a basic set of, there's a new mobile health center model that we passed first in 2019. And really the community makes the decision on what to pursue. Physical health, mental health services that are offered. But beyond that, the community has an opportunity to dig in and decide, the extent of the services. So, I just go back, and that's good for Oregon. I mean, one size does not fit all. And then as far as scope of services, there's a basic set of physical health, mental health services that are offered. But beyond that, the services. To the slide, you can see, a wide geographic diversity. Once a school-based health center is open, people are almost universally happy with the services they have. Sometimes they expand those services and add more services over time, but it's been very popular. And then I want to have worth absolutely happy with the services they have. Sometimes model. It's a great investment. The state puts in 25 cents and gets $1 back. For 25 cents, we're on the dollar. The state is gaining $1 worth of healthcare. So it's a great bank. It leads to better health outcomes, better educational outcomes, less disciplinary actions, less absenteeism in all the schools that we have in SBHC for the buck. It's a great economic model. It's a great investment that the state puts in 25 cents and gets $1 back. It leads to better health outcomes. Part of the problem is the scope and the level of acuity is going up, and there are more youth in schools throughout the state who need these services. And so that's why adjusting for inflation, better educational outcomes, less disciplinary actions, less absenteeism, protecting the workforce and giving more school districts the opportunity to pursue this is so important. So that was probably more than 2 minutes. Adjusting to do this is so important. So that was probably more than 2 minutes, but I wanted to cover the questions that were raised. And I'm happy to answer any questions.
Representative Deal.
And the provider and the communities involved. But what do you say to parents who are concerned about their kids? Thank you, Chair. Thank you, Doug. So you've talked about these are locally controlled. There's a memorandum of understanding between the district and receiving care without their knowledge or consent.
Representative Deal, members of the committee, I think that's a legitimate question, and the answer is that.
And the provider and the communities involved. But what do you parents who are concerned about their kids receiving care without their knowledge or consent?
We not only do school-based health centers follow federal law as far as requiring consent under the age of 15, but they also encourage. Representative Deal, members of the committee, I think that's a legitimate question, and the answer is that we not only do school-based health centers follow federal law as far as requiring consent issues. You've heard and seen a single instance where a school-based health center has not shared information with the parent or gained approval ahead of time. There's a form that must be filled out for youth 14 and under. And at 15, it's the federal law shared, but I've never seen a single instance where a school-based health center has not shared information with the parent or gained that governs that issue.
Thank you.
Okay. Sure, go ahead.
Yeah, thank you, Chair. Hi, Doug. So with the
Approval ahead of time. There's a form that must be filled out for youth 14 and under. And at 15, it's the federal law that governs that issue.
Thank you.
piece of the nonprofits, that's the 1.4, right? That's going to be up. So with the nonprofit.
Okay. Sure, go ahead.
Yeah, thank you. Hi, Doug. So with the piece of the nonprofits, that's the 1.4, just right? That's going to be up. So with the nonprofits will provide, if there is one, right, in the community, they provide technical assistance and planning, so just practical.
The planning process really is important. It's the opportunity to ensure that we have a good business model and that we are meeting what the community says are the most important needs.
How do they work together?
I met 1,000 school-based health center with very little community input, very little board participation, and they didn't have the green eye shades and the accountants come in and say, hey, you can't make that. In 2009, the model was a school district would decide to open a school-based health center. They would open a school-based health center with very little community input, very little board participation, and they didn't have the green eye shades and the accountants come in and say, hey, you can't make that float. And so many of them failed in guiding the community through that decision-making process. And so it's awful lot more efficient since they've done it. And so what we've done is we've required that they go through that process. The Oregon School-Based Health Alliance, which is a nonprofit that does statewide work, a lot of times say, here are the 10 things you need to consider. Not that we're deciding it for you, but have you thought about billing? Have you thought about partnering with the local CCAs, expert in guiding the community through that decision-making process? And so it's awful lot more efficient since they've done it a lot of times, say, here are the 10 things you need. Have you selected a medical sponsor? Have you anticipated inflation? Those types of things are really important to do at the beginning of the process. So once the school-based health center opens, it's sustainable.
Okay.
CC is really important to do at the beginning of the process. So once the school-based health center opens, it's
Keep it sweet and short, but we're going to go smidge over.
sustainable, and it meets the community's needs.
Okay, if there's no other questions for this witness, I'd like to call Tom Sinsick forward. And Tom, I hate to tell you to keep it sweet and short.
I can do 2 minutes.
Okay, perfect.
Chair Nose, members of the committee, Vice Chair
But smidge over.
2 minutes.
Perfect.
Goodwin and Nelson, and members of the committee. My name is Tom Sinsick. I'm a retired family nurse practitioner who moved to Portland in 1987 with the intention. Chair Nose, members of the committee, Vice Chair Goodwin and Nelson, and working in a school-based clinic. I was lucky enough to spend some time with the Juvenile Detention Center and the Corrections Health that guided me in my thinking. And members of the committee, my name is Tom Sinsick. I'm a retired family nurse practitioner who moved to Portland in 1987 with the intention of working in a school-based clinic. I was lucky that guided where a kid committed suicide. And that incident was when a kid wasn't able to come into our clinic. They were down the hall in the school. As we know now, the word coverage is not care and access to care. For all those 26 years I worked in a school-based clinic, there was only one time there was an incident where a kid cool, but the mental health services were not there. They were sent to their provider, their private provider. They never made it. For the next 3 years, I saw the sis committed suicide. And that incident was when a kid wasn't able to come into our clinic. They were down the hall in the school, but the mental health services, instead of, no mental health services. So I did my training mostly in working with mental health, my continuing education during all those years. I always remember that moment. Mental health, my continuing education during all those years. I always remember that moment. The kid that I had never seen, the one I could have seen, that were